All right. I've been waiting for this show for a few weeks, and I'm very, very happy finally I can have Dr. Achina Stein. She's a osteopathic physician and psychotherapist and functional medicine practitioner. The reason I like to interview her because she has a lot of skills in one place, and for me it's so interesting that a medical doctor also know the value of mind and body connection. I'm going to welcome her to my show. Welcome, Achina, to my show.
Oh, thank you so much. Thank you for having me. It's my pleasure.
Yeah, thank you. All right, tell me about yourself first. Why did you become a medical doctor first? I mean, osteopathic physician, and what is your own health path to functional medicine?
Oh, wow. I mean, that's a broad question, but I became a medical doctor because um, well, specifically an osteopathic physician, was because I was very much interested in the holistic approach. I felt that everything was connected from an early time, and I didn't necessarily feel that the MD approach which is siloing different organs and seeing them as separate. But what really fascinated me was that not only are we taught everything that the MDs are taught, we're also taught osteopathic manual medicine, which is really understanding that basically A.T. Stills, who invented osteopathic medicine, was concerned about how the muscles and the spine are connected, and all the nerves go through the spine, and all these nerves are interconnected with all the organs. So you could potentially diagnose the different conditions based on what we call osteopathic lesions along the spine through palpation, and manipulate the spine in order to bring relief to those organs. And so I was fascinated with that, and I actually withdrew my MD applications and decided I'm going to be a DO. I made a conscious decision when I was applying for medical school. So I made a conscious decision to actually become a DO. So because of those reasons, but for me, my health journey, and not so much my health journey, but my son's health journey, is what brought me to functional medicine, which is along the same lines. It's looking for the root causes and of disease or disorders, and it is recognizing that everything is connected, and that you can really, when you look for the root causes of the problem, you can actually resolve lots of symptoms, not just in lots of symptoms across organs, not just in one specific area. And it's almost like, if you think about it as, if you had a rainstorm and a lightning strike, hit the electrical grid, right? All the houses are going to go out, but it may not go out in other neighborhoods, next to that, because it wasn't their electrical grid. And so if you started treating each individual house as in not recognizing that there was something that happened external to that where all the houses were connected, then you'd be missing a major factor. I mean, really missing something serious. So my electricity's out. Is it because the switch is not working? Is it because the light bulb is broken? Is it because the wire from the light bulb to the switch is disconnected? Like, there's so many different levels of where there could be a problem. So I think it's easier for people to understand when you give an external example of a problem as opposed to an internal example, because it just makes common sense. It's just common sense medicine in my opinion. So
Yes, it's so interesting. And, that's what I said in the beginning before we start the show. I'm really amazed with how your field, osteopathic, actually work with holistic medicine. And I've heard this from chiropractic doctors as well. I just want to know what's the difference between these two fields, and how do you connect your field to holistic medicine?
So we're both chiropractors and osteopathic doctors are very holistically oriented, but osteopathic physicians also can prescribe medications. So I would say that if you had, and I'm not 100%, so don't quote me on this. You know, you have a chiropractic field and you have the MDs here. The osteopaths really cover both. You know, not completely both, but you know, we do everything that MDs do, but also do some types of work in terms of manual medicine, similar to what chiropractors do, but not exactly the same. So yeah, I don't know if that answers your question. You're actually the first person to actually ask me that question.
No, because I'm talking to so many people
Yeah.
and so many doctors. I try to show it to other people who don't know about
Right.
these different kinds. Because
Right.
for myself, as somebody who never studied medical, so it's question. I know for general people also.
Yeah. Yeah. I am becoming less and less allopathic or conventional or traditional medicine, and more uh, on the other extreme of holistic medicine, in terms of I'm prescribing less and less medications these days. Why? Because I don't need to. But there are going to be situations where I do need to. And so it's acute care versus chronic care. So conventional medicine is really great for acute care. Thank God we can do surgery. Thank God there are medications that save lives. But so in an emergency or urgent care, or when people can't function at all, thank God there's medications, you know. But when you have chronic care, you're functioning, but you have these symptoms that don't allow you to thrive and meet your optimal potential, or they're either annoying or can even be debilitating that you're just living with. Chronic care medicine is really a better way to approach it. And so chiropractors and functional medicine doctors, it doesn't matter that I'm an MD or a DO, because there are a lot of functional medicine doctors who are MDs and DOs and DCs and nurse practitioners. You know, it actually brings together all of the different traditions of medicine when it comes to functional medicine, because it's a different approach, and it's an approach to chronic care. And the way we approach chronic care is by looking at lifestyle and diet. And there's a lot one can do to improve symptoms by looking at diet and lifestyle.
I see. So I know you're going to talk about reversing depression. According to what you studied, I just want to know why they are related, and why are you talking about this? And I know you already written a book about depression as well.
Yes, I did write a book. I called it What If It's Not Depression? Because so many times people are given a diagnosis of depression. So I am trained as a psychiatrist, and I also do psychotherapy besides functional medicine. But once I became a physician, I specialized in psychiatry, and within psychiatry, I also became very well trained in psychotherapy. So, and I was practicing those modalities for a good 20 years. And I, came to learn a lot of the limitations of medications when it comes to the treatment of depression, with my son specifically. So, he became acutely depressed, and we thankfully had medications to stabilize him and get him to a place where he was not in danger and feeling better, but he wasn't my son anymore. It's just, he had lots of side effects, and he hadn't gotten to a place where he felt good. So that's when I really dove into functional medicine to find other ways of, improving his health beyond just medications. And that became, that was the driving force for me to finally become certified in functional medicine. That's how I practice today. It was only after that, because mothers always put their children and families first, that I started taking care of myself and treating my own health issues. But it really just started with my son. And so when the concept that people need to understand is that depression, has biological roots, it has psychological roots, social roots, but it also has physiological or functional roots. So you can actually get depression from not digesting appropriately. So if you're not eating the right foods, first of all, you want to eat the right foods, providing all the raw materials to your body that it needs in order to function appropriately, and that your brain needs in order for it to, make all the connections, electrically, and it needs fats and it needs proteins. All your neurotransmitters are made from protein. So if you're not eating the appropriate proteins and the appropriate amounts of proteins and fats, your brain's not going to function. It's just not. So most people, especially in the US, and I'm not so sure if it's as much in Canada, but in the US, a lot of people eat a great deal of processed foods and sugar, a lot of junk food. The diets are very poor. So just by making the change in your diet can make a huge improvement in your mood. But that's just one driver. There's other things as well. So it's looking at all the different layers that might contribute to the state of depression. And it's in those 4 areas: biologically, psychologically, socially, as well as functionally. And so I go through and find all the layers through an assessment, and we create a treatment plan to address each and every one of those drivers. And some of them you can see very, very quick results, and in others it's longer. It takes a longer time. Things like childhood trauma, that's been there for ages probably. And so it takes a lot longer to address things like that. There's other things like mold toxicity and small intestinal bacterial overgrowth. There's another biggie besides those 3: childhood trauma, mold toxicity, and small intestinal bacterial overgrowth. But there's a number of things that you can easily fix very quickly, all on your own, just by finding those drivers. So my book basically explains the way to do that. So it's finding those drivers and then the solutions about how to address them.
That's so amazing when physical and emotional trauma really affect your body. And you cannot separate depression from your body, which is functioning well or not. As you said, digestion is so important, because I have clients for my fertility coaching, and I see lots of them have got issues. When you have got issues, all the supplements doesn't work for you. Like all the supplements, you can use it because you cannot digest it well, right?
Right. Yeah. So there's 5 categories of drivers, and it spells a nice word called shift. So you want to shift your physiology, shift your body, and it's looking at stress, hormones, infections, foods, and toxins. And that's a good way to remember it: stress, hormones, infections, foods, and toxins. And when we talk about infections, it's looking at chronic infections that can burden the immune system. So your immune system is there to protect you, and basically your army, the army of your body, to protect you from things. And so sometimes we get infections, and it creates this colonization, so to speak, and your immune system has to take care of it on some level, which is an investment of energy to some degree. So it's a lot more complicated than the way I'm explaining it, but I'm trying to explain it so that people understand. So, but those are the drivers that I look at, and we address each of those areas and create a plan to reverse as many as we can, so that you don't have to rely on medications.
Yeah, I
So
think uh, when you feel sick, like physically, yes, you go to all the tests. You can add functional tests to those medical tests as well. And that even applies to when you are emotionally sick. So you see, when you are emotionally sick, sometimes you go to psychotherapists, but because they are not functional medicine trained, or they don't know about the physical body, they may never find your root cause issue of the problem. But that's so interesting how you see everything is related to each other in your body.
my target symptoms for a patient would be depression, anxiety, or other mental health issues. Everything that I do actually addresses the whole body. So if you have joint pain, if you have stomach issues, if you have skin issues, a lot of those things get better as well, because it's a lot of the same drivers, which is rooted mostly in our lifestyle. So much can change just by addressing lifestyle and dietary. But most conventional doctors don't really know that to the degree that to explain what specifically to do to make those changes. They also don't have the time. It takes a lot of time to sit down and figure all of this out. So I call it putting on our Sherlock Holmes hat and sitting together, and I have a 39-page intake just to gather puzzle pieces of your history, to put them together to figure out, like, where did things go wrong for you. It would be like buying a house, that's, if you like to remodel homes and buying a 100-year-old Victorian house, what's the plan of how you're going to fix that up, right? Because if you continue to, if you continue to, if you're not maintaining that house, if you're not maintaining that house or reversing those conditions of the house, then it's going to fall apart eventually, right? So it's all maintenance. It's not, striking it down and building a brand new house on its, from scratch. So it's a similar kind of approach where, you're going to look at the floors and clean that up, fix different bathroom fixtures and the plumbing and electrical. A lot of things go into fixing up, an old home, right? To renew it. You do this kind of the same thing with your body when you do functional medicine.
Yes. Okay, we have few second break and we come back here again. Please subscribe to Pantea Kalhor Transition channel and order my book Naturally Conceived through Amazon. Thank you for watching. Yeah, the interesting thing is this month is PTSD awareness month. So we talk a lot about depression, anxiety, and awareness. We have awareness for this month. And next week, I have a summit on June 23 and June 24. That's why I found this very related to what we are talking right now. Because as you said, there are lots of layers for depression and anxiety, as is not only what you see, like your symptoms, and you may have many, many other layers, like physical, emotional, that you need to discover.
Well, the conventional approach is to find a diagnosis, in order to match a pill to the ill. So to match a medication to the diagnosis. And that's the approach. And it works for some people, but it doesn't work for many people. So, I'm just providing an alternative way for those people who want to feel even better, or if they're having side effects, or if those medications aren't working.
Can you show us your book, please?
Yes, absolutely. Yes.
Yes.
What
Can you talk about this?
Say again?
Can you talk about your book?
Sure. Yeah. Well, my book is basically it helps a person to find their own root causes. And it really reflects everything I do in my private practice, except I wanted to let people know that there was another approach, and that these are all the things that you could do on your own and improve. So it's basically going through all the different layers that you could potentially do on your own. There's exceptions. There's going to be situations where you're going to need to get blood work or do some specialty testing. But like I said, there's a lot that one can do on your own. In fact, I do have a boot camp that is a companion program to my book. And it's a 12-week program. And I'm actually enrolling for the next one. So it's been very successful. And I feel like there's lots of things to improve in the boot camp that might not necessarily improve if you were to see me one-on-one. So for the person who's having the milder to moderate depression that's chronic, but you're functioning, you have stable life and working and taking care of your kids, whatever it is, but you still have these symptoms, that's who this boot camp is really appropriate for. But if you're much sicker and have lots and lots of issues, then I recommend that you see me in my private practice. So, but I talk about everything that I do in my private practice in my book. So it's a great way to get to know, what I do. And it's a great way for people to know what functional medicine is as well. Even though my focus would be mental health symptoms, ultimately, I really help you to get through your whole health journey, not just the mental health piece. We're just starting from that and diving deep into other areas as well.
So, how can they access this program?
You can go to www.whatifitsnotdepression.com. And you could also go to my website. It's www.achinasteinDO.com. And so the first one tells you a lot about my boot camp. The second one is basically telling you about the two businesses that I have, the boot camp versus my private practice. Yeah. And you can download my book for free from the website too.
I try to write it here so everybody can see it. www.whatifitsnotdepression.com, right?
Yeah, it's WHATIFITS.
Hang on. Is it this one?
I would take it's IFITS. So take the I out.
Take the I?
Take the I out between the T and the S.
Okay, got it. I'm going to take the I out.
Yes.
Yeah. That's it.
That's it. That's correct. Thank you. Yes.
Okay. Great. So they can go there and access your program 12 weeks for finding root cause of depression issues. Right. That's a self-discovery, and they shouldn't wait to see the doctor. If they have, actually, as you said, if it is not acute and is not really severe, they can do the self-discovery on themselves.
Well, to be on the safe side, it's always good to see the doctor. I mean, especially if you're, if you're having acute symptoms, and particularly if you're not feeling safe. So it is definitely good to see the doctor. But if after things are cleared with the doctor and you feel stable, then you might want to look at the boot camp and that's offered. That's for anybody in the world to enroll in. So, but if you're much, if you're not well enough to do the boot camp, then I suggest you find a functional medicine provider in your area, and you can actually find one through the Institute for Functional Medicine. It's www.ifm.org, and they do have a provider locator on their website.
How we can actually realize that we have depression? What are the symptoms?
Well, so a clinical depression, like major depression, tends to be pretty severe. And it is rated as mild, moderate to severe. It's usually having depression every day, most of the day, for 2 weeks, along with other symptoms. So it's either depression or anhedonia, which is a medical term for lack of pleasure in things. So every day, most of the day, for 2 weeks. And it has to be accompanied with other symptoms like low energy, problems with sleep, either hypersomnia or insomnia, problems with appetite, problems with energy. I think I said that already. Concentration problems or attention problems, and low self-worthlessness, and or suicidal ideations. And sometimes it can be accompanied with having problems with your perceptions, like having hallucinations, either visual or auditory visual hallucinations. So it's having those symptoms along with the depression symptoms every day, most of the day. That's just one diagnosis of a type of clinical depression called major depression. There's other types like dysthymia, cyclothymia. So, and those are all DSM diagnoses. But those diagnoses don't tell you anything about the cause of depression. It just is basically a compilation of symptoms that were decided by a large group of people to say, okay, if this person has this diagnosis, we give them this treatment, meaning medication. And if they have this diagnosis, then this treatment is best for that diagnosis. So it really doesn't speak to cause. However, there is the practice of medicine or of psychiatry is that you should rule out medical causes, but many of those medical causes are beyond just getting a B12 folate, B12 folate level, a thyroid, TSH, which is for the thyroid. Getting a CBC in terms of looking at anemia, which is a complete blood count. So there's a certain set of medical disorders that doctors should be looking at immediately in terms of biological causes of depression. And sometimes that's not even done. It should be done. It's part of, that's part of the standard of care. But sometimes people are given these diagnoses by psychotherapists, and that information is given to the primary care provider, and it's just assumed that someone's done this medical review to rule out some of these problems, but it kind of gets lost in the mix just because the visits are fast, the conversation doesn't get had, a lot of assumptions are made. So, and then you carry around this diagnosis and no one has even looked at whether or not there's a medical cause. So it's really important for people to know that there are lots of medical causes and that someone needs to sit down with them and really do the blood work to rule out all of the medical causes. So functional medicine really expands that limited number of tests in order to find all the possible causes. But those tests and what to order is informed by sitting down and really doing a review of history, a detailed review of history to see what's happened in your life that might point you in the direction of ordering these appropriate tests.
Thank you so much, Achina, for being here. I really enjoyed talking to you. That was really unique topic, talking about different fields of medical. that really relates to depression and emotional traumas. And it's so interesting to know that every pieces of your body should function together. So thank you so much. If you have any recommendation at the end, please give us some recommendation how we can be more healthier. I mean, how we can be much healthier and how we can cope with depression.
Mm-hmm. Well, like I said, changing your diet, moving, doing, exercising or having some kind of movement program, doing meditation. There's all sorts of things that you can do, but the diet is something that can actually improve your mood significantly, even in 1 month's time.
Really, that's
Mm-hmm.
interesting.
Absolutely.
But is as you said, it's better you go and check your body because you may not everybody's diet is the same. So people are different. You may have some sensitivity to some foods that other people don't. So you need to check your body probably with functional medicine to see what is the root cause of the issue, and then you go for the diet.
Mm-hmm.
Yes. All right, thank you so much, and I wish you really great weekend.
Okay.